In this month's issue, we're going to discuss the changes that may be coming down the pipeline regarding insurance reimbursement in the venous space. As you know, everyone knows we've just come off a presidential election, and there's a lot of debate on the healthcare issues. We all know that healthcare is becoming more expensive, and we need some cost containment measures going forward. And of course, now we're all facing the Obamacare rollout, so to speak, and how it's going to affect us. But the reality is the reimbursement for venous disease will likely change, and not for the better as far as the doctor's concerned. We'll probably be getting paid less. And even mild disease like class 2 disease, which are small bulging varicose veins, they may be taken off the insurance shelf altogether. So we need to start preparing our practices for changes like this, that for example, a routine varicose vein patient may have to pay out of pocket completely for his or her procedure, whereas someone with advanced disease like a venous ulcer, perhaps insurance will continue to reimburse that. And how do you manage your practice to deal with all these things? The last few years at IVC, we have not been shy about discussing insurance reimbursement and how it might affect one's practice. There have been several committees in play, and I sat on one of them on trying to get some type of structure, some type of cohesive structure of guidelines that insurances should be looking at that are based on evidence and facts regarding venous disease patients. Currently, insurance reimbursement is very capricious. All the payers have their own policies, and they put it incumbent upon us to know all the rules of every payer, and it's kind of difficult to keep up with all these things. And they're all changing. They're a moving target. They seem to be getting more and more difficult, more and more requirements, and less reimbursement as we go forward. So we try and prepare the folks on what's coming down the road so they can make adjustments when they get back home. So if you want more information regarding insurance reimbursement, you've got to come to the meeting May 2nd through the 5th at the Fontainebleau Hotel. We will get into that in a lot more detail.